Hello, my name is Yamini Oseguera Bhatnagar with Hive in San Francisco. I'm here with Angela Kaida here at Match Research in Durban, South Africa. Hi Angela.
Hi Yami.
Tell us a little bit about yourself.
So I am a researcher. I'm based at Simon Fraser University in Vancouver, Canada. I'm currently based in Durban, South Africa, working on an adolescent HIV prevention research study called IAZAZI.
Yes, IAZAZI is great.
Yeah.
Tell us a little bit about IAZAZI.
So IAZAZI is really wonderful study. It's an interdisciplinary study where we have researchers who are engaged in HIV immunology and virology research, as well as epidemiologists like myself and people who do work in sociostructural understandings of HIV risk among young people. And collectively, we all know that young people, particularly in South Africa, are among the highest risk population in the world for acquiring HIV infection. And so IAZAZI is an interdisciplinary study with the primary aim of trying to understand what does risk look like for young people when we're able to overlay data that comes from the biomedical sphere, the sociostructural and behavioral sphere, as well as the clinical environment. And how do those features come together to produce risk for young people?
Great. Angela, we spoke about a few minutes ago actually, reproductive rights and what that means, not just here in South Africa, but also in your work in Canada and Uganda and other places. And I found that you had a wonderful, comprehensive sort of understanding of reproductive rights, and I was hoping that you'd share that.
Yeah, so the reproductive rights language has been around for a long time. Like the ICPD conference in 1994 sort of set the stage for how we talk about reproductive rights. And usually those speak to, everybody, each person has agency or should have the right to build and create the families that they want to create, right? And so part of that to me means being able to have children when and if you want children, or not having children when and if you don't want to have children, and ensuring that you've got the information, the services, the support, and again, the agency to be able to do that. And those rights, of course, are inclusive to all people, including people living with and affected by HIV.
Let's talk about sex, and let's talk about sex, and sort of what role does normalizing sex and sex positivity play in reproductive rights for women living with HIV?
Yeah, so I like that question so much. So a lot of work is going into sort of normalizing pregnancy among women living with HIV, and that's really about respecting these reproductive rights and acknowledging that people living after knowing their status, even after knowing their status, want to have children. They want to create their families. They want to have children. And so a lot of discussion has happened around the support services available to be able to do that, and kind of normalizing this idea of normalizing pregnancy among people living with HIV. And I think a really critical step, or a step before that process, where we really have to sit with the idea of normalizing sex among people living with HIV, and normalizing a sex positive approach that doesn't just view sexual health as being about HIV transmission or condom use or number of partners, right? And really takes back the language of sexual rights, sexual agency, reappropriating those sexual rights for people living with HIV.
And I'm sure this is very relevant for your work with adolescents as well.
Yeah, well, I think we spend a lot of time talking about, in public health, it's a little bit of our job, talk about risks, bad things that are going to happen. And we haven't done as good a job of talking about healthy sexuality, right? And taking a stand that says there's healthy sexuality and you can be a positive person and still have healthy sexuality, right? And ensuring that we kind of embrace that broader language and are not always about risks and bad things and terrible things that are going to happen. And I think that change in our language and our approach is going to be really important if we want to create spaces for young people to talk about their sexual lives or talk about their sexual questions. Right? We need to kind of create a space that's more sex positive.
Yeah, absolutely. You have done work, a lot of work in Canada, and some work in Uganda as well as here in South Africa.
Yeah.
And I was wondering if you could give us a little bit of an idea of how the epidemic in these places is different, how it's similar, what has worked and what has not worked.
Yeah, so it's like a billion, trillion dollar question. But what I will say, I'll say a couple things about that. So yes, I had the privilege of working in each of those countries, as you mentioned, and working with really amazing researchers and clinicians and community members, and particularly women living with HIV who are at the forefront of some of the most important, I think, activism on sexual and reproductive health and rights. So that's been really wonderful. I think one thing that is sort of true across those sites is the role of women across all of those sites. The epidemic looks really different in Canada, right, versus Uganda, versus South Africa, in terms of HIV prevalence, incidence, most affected communities, etc. Fertility and pregnancy also looks really different between those three settings, access to services, etc. But one very consistent theme is about women, and women remain a highly affected group of people in each of those three countries. Women tend to be diagnosed with HIV at a later stage of disease. They tend to have a higher incidence of HIV, particularly among young women compared to their male counterparts. When they are diagnosed and initiated on treatment, adherence tends to be suboptimal among women compared to men. And those sort of findings are consistent across all of those settings, right? And that's a problem, right? That's a big problem. That's a structural problem. That's a gender problem. And I think we've got a lot of work to do ahead of us to sort of just unpack that, right? And really make sure that we are developing interventions and we're responding to women's priorities to try to overcome some of these trends of increased risk, increased burden, increased illness.
In terms of responding, let's talk about community-based research and maybe how that is helping or is sort of a way to respond to the epidemic in different places, because I know you've been involved with some and you're definitely a proponent of community-based research.
Yeah, definitely. So I've been fortunate, I think, to come to community-based research a little bit later in my training and in my work, and it's been really transformative to my approach to research, to the types of questions that I pursue and all of that, and to the women that I get to work with. So, part of the HIV sort of mantra is know your epidemic and know your response, right? No, those two features are absolutely critical if we're going to be able to develop interventions that work, are acceptable, are feasible, etc.
Absolutely.
And, community-based research sits right in that nexus for me. So knowing your epidemic is knowing the people who are living with and affected by HIV, and ensuring that their voices and their faces and their priorities are really at the forefront of the type of research that we undertake, as well as the way that we do research. Right? So it's both process and ends that matter. And in terms of informing our response, right, these are the same groups of people who need to be, again, at the forefront of our work on how do we identify strategies that are going to be acceptable to the communities that they're directed towards? How do we implement processes that are, that are consistent with the priorities and needs of the affected communities? And so community-based research has just been a very effective and important strategy to meeting those goals.
Right. What better way to understand the needs of folks but to hear from themselves?
Right. It's their lived experience that is going to take us to, I think that's going to take us to our, we've got a lot of goals in the next couple of years. Some very ambitious goals have been put on the global health agenda around ending AIDS in 2030. Youth need to be leading so much of the work that needs to happen to meet that goal. And women need to be at the table. Their priorities and their realities and their lived experiences need to be, very loud voices at the table if we're going to meet those goals, which we all are definitely working towards
And gearing up for.
Definitely.
Great, thank you. That was very informative and very visionary. And I hope, and together, that community-based research and just putting people's voices in the forefront of all of our movements is going to happen, and is going to lead us to the end of AIDS.
Me too. Thank you.